Good day everyone. You're all welcome back to Gift My YouTube channel. And today I'm going to be sharing with us on the topic painful sex. What are the causes of painful sex? The symptoms of painful sex. But before then, if today is your first time of coming across my YouTube channel, please like, share, subscribe, and drop your comments at the comment section. Thank you. And if you're a return follower, I tell you, God bless you so much. Thank you. So back to the topic of today, painful sex. So we're going to start from where? From the symptoms of what? Painful sex. How do you know you have painful sex? How do you know you have effects of what? Of painful sex. So we're going to start by telling you, if you have painful sex, you must what? You might feel it in different ways, okay? If you have painful sex, you might what? Feel it. And number one, when you have painful sex, pain only at what? Sexual entry. Pain what? At the sexual entry. What is called entry? Under word, if you want to use entry, you can use entry in another word as well, superficial. So pain at what? The entry. So which is what? When the man is trying to penetrate into you, that is when you start feeling the pain. So number two, you have a pain with every penetration. Pain with every what? Penetration during putting in what? In the you put in what? In the tap tone. This one is one of the pain which include what? Putting in what? A tap what? Tone. So number three, we have what? We have the bony pain. We have the bony pain and what? The aching pain. And we have what? Deep pain during what? During what? Thrusting. We have the pain that come what? During what? Thrusting. And we have the what? The trembling pain. We have the trembling pain lasting hour after what? Sex. This trembling pain occurs after the lasting hour after what? Sex. So let's go to the what? The causes of what? The painful sex. The causes of what? When you have pains, anytime you have intercourse, the causes that always bring what? To this pain. So we have two causes. These two causes will come in different direction. So one, we have the physical and the emotional. I come again, we have the physical pain and we have what? The emotional pain. So let's go to the physical. Under the physical, we have what? Entry pain. Like I said before, entry pain. Under entry pain, you have what? You get to superficial. So under entry pain, we get superficial. So which means if you don't want to call it superficial. So what is entry pain? Entry pain is called, it is a pain. This a pain occur during what? Penetration. During when the man is trying to penetrate, this is when the pain it do occur. The man is what? Trying to penetrate. This is when what? The entry pains occur. Then we have what? The deep pain. We have the deep pain. So when you want to classify the deep pain is when the man is already inside of you. Already when the man is already what? Inside of you. And most cases this pain come what? When you start feeling the pain on your lower abdomen. When the man is already hitting on you and you start feeling those pain, this pain what? These are one of the causes of what? The deep pain. When you want to know if you have a deep pain, you does not start what? From the surrounding. No. The surrounding is called what? The physical pain, which is what? The superficial. But when you feel it inside of you already, that is what we call what? Deep pain. And during that is already what? When the man has already penetrated inside of you. But when the man is trying to penetrate, it's called what? Superficial. But when the man is already inside, it's called what? Deep pain. So we have what? The causes of what? The entry pain, which is what? The superficial. The causes of what? Entry pain or superficial pain is what? Injury trauma. Injury trauma or irritation pelvic. Injury trauma or irritation what? Pelvic. We have the surgery, the pelvic surgery. We have the female circumcision. We have what? A cut made during childbirth. Most times when a woman is giving birth, and the fetus is not really open, the cervix is not clear, they have to what, cut. During that, some women, they don't like when you cut them, that you have to stitch back, and this can lead to what, painful sex at when time goes on. So one of the things when you have what, cut during childbirth, this what, it's enlarged childbirth, carnal what, epistopy. It allows the childbirth during what, the carnal what, epistopy. So these are the causes of what, deep the superficial pain of what, painful sex. So we have what, inflammation. We have inflammation, we have the infection, we have skin disorder like eczema. Skin disorder like eczema is also one of the things that can cause what, superficial pain. So also we have what, we have the urinary tract infections. We all know urinary tract infection. When a woman has urinary tract infection, it is a bad and it is a damage. So it is not good. These things can lead to painful what, sex. When a woman has this, you are 100% to have what, this painful sex. So, and also we have what, most times those things happen at your genital area. It happens what, at your genital area, a problem that is present at what, giving birth. It is what, a problem present what at birth. And also we have what, we have vaginismus. We have what, vaginismus. The vaginal muscle tightening also can make sex painful. You know, there are some women, maybe it's your first time of having sex, and it's hard for the man to what, to penetrate inside of you. That is what superficial. It is a superficial sex, a painful sex. It's an entry sex. So when a man is trying to force himself into you, you feel what, superficial painful sex. So let's go to the deep sex pain. We have what, the pelvic inflammatory disease, which is what, the PID. Pelvic inflammatory disease. We have the ovarian cysts. We have the fibroid. We have what, the endometriosis. And what, we have the endometriosis. We have the what, PID. We have the fibroid, and we have what, the ovarian cysts. So all of these come together. It leads to what, deep pain. When a woman has deep pain sex, when a woman has deep painful intercourse, the only way you can know, or what can cause those things for you, is when you have what, the PID, pelvic inflammatory what, diseases. When a woman has fibroid inside of her and she's having a forceful sex, it causes what, that is one of what, the deep sex we are talking about. So, and also some people will say emotional causes and what, feelings. You might think emotional causes or emotional feeling does not have anything to do with sex. No. When someone has past emotions, past feelings like anxiety, stress, when you have maybe so many things that must have happened before, like someone that was being raped, and at the end of the day you want to have an intercourse with your man, and each time these things flash back, it's like you play back the role. So something like this can always give you what, emotional pains. These are one of the emotions we have during sex. These are the emotional what, sex. These are emotional painful sex. So when a woman has so many things, like when a woman is being stressed, it makes her vagina more tightened than it's supposed to be. When a woman does not have what, more lubricant, it can cause what, more painful sex. And when a woman has what, depression, can cause what, painful sex. So with these, I think you'll be able to understand the causes of what, superficial sex, and also the causes of what, deep sex, and how you know if you have deep painful sex, and if you have what, the superficial sex. So the superficial, it is when the man is trying to penetrate, while the deep sex is when the man is already inside of you, and when the man is already having an intimate with you, and you start having the pains start occurring, the pain start coming. That is what a deep sex. It is a sex that the pain that always happen inside of you, not outside. The outside of the surround is called superficial, while the inside is called the deep pain. So thank you for watching my videos. Thank you for watching and liking and commenting. If there's anything you want me to answer, any questions you want to ask, just drop your comment and we'll get back to you. Thank you so much. Stay tuned to watch more of our videos. Thank you. Hi, good day everyone. Welcome to Gifted Smile YouTube channel. And today I'm going to be sharing with you on the topic diabetes. But before then, if today is your first time of coming across my YouTube channel, please like, share, subscribe. Also turn on the notification bell so you don't miss out on our video whenever we drop our videos. And also, if you're a return follower, this is Gifted Smile, say a big thank you to you. So what is that? Diabetes. Welcome. What is diabetes? Diabetes, it is a chronic, long-lasting disease which affects how our body turns food into energy, or you can also call this sugar glucose. It affects how our body turns food into energy. So we have the types of diabetes. What are these types of diabetes? We have type 1 and we have type 2. Type 1, it is an immune system. It is an immune system which affects and destroys the cells in our pancreas. So we have type 2. Type 2, it is when it occurs when your body becomes resistant to insulin. It occurs when your body be resistant to insulin. And we have prediabetes. Prediabetes occurs when your blood sugar is higher than normal. It occurs when the blood sugar is higher than normal, which means not higher enough to diagnose type 2. It is not high enough to be diagnosed of type 2. And we also have gestational diabetes. This one happens during pregnancy. When a pregnant woman has diabetes, what causes it is gestational diabetes, which can lead to insulin blocking, and it can also cause placenta damages. It can also lead to placenta damages. And also we have the symptom. We have the symptom of diabetes. What are the symptoms of diabetes? It is when you have the increase in hunger, increase in taste. Someone that has too much increase in hunger, increase in taste. And also we have extreme fatigue. Extreme fatigue. And also sore that does not heal. Most people, they have injury for a very long time and it does not heal. It's not because the sore is not supposed to heal, but when you have diabetes, when the diabetes has become so high, it is difficult for someone with injury to become easily healed. So the symptoms are not healed are part of one of the symptoms of diabetes. And we have weight loss. We have frequent urination. Weight loss, frequent urination. So these are the symptoms of diabetes. One is when you have increased in hunger, increase in taste, extreme fatigue, sore that does not heal. Okay, so and we have weight loss, frequent urination are the symptoms of diabetes. So also we have some symptoms for men and some symptoms for female. Okay, men has the way they feel when they have diabetes, and women has what they feel when they have diabetes. So let's go for the men. What are the symptoms of diabetes in a man? It makes them have decrease in sexual drives. It makes them what have decrease in sexual what drives. It has what erectile what dysfunction. It becomes what it becomes. It affects what their erectile what dysfunction. So we ask for the women. The women, they have what urinary what tract infection. Urinary what tract infection. They have also yeast infection, dry and what itching skin. Women, when they have what itching on the skin and they have what urinary what tract infection and what yeast infection, these are signs of what the symptoms of both men and female when they have what their diabetes. And we have what the causes. We have what the causes. We have between the causes of type 1 and we have the causes of what type 2. We have the causes of type 1. It is what? It is when your immune system mistakenly attack and destroy insulin, producing beta cells in the pancreas. So type 1, it is when what your body, the diabetes, what the immune system has mistakenly destroy. It mistakenly what destroy the beta cells. What produce the beta cells in our pancreas? When it's destroyed, it is one of the causes of what type 1 of our diabetes. And we have type 2. Type 2, it is a combination of genetic what and lifestyle factors. Type 2, it is what? It is a combination of genetic and lifestyle what factors. Being overweight became what? Risk. Type 2, it is a combination of genetic, lifestyle and factor. Being overweight, it is what? It is a risk also. So we have what? The diabetes complications. Everything has complications. When they have symptoms, they have the causes. Also, they have what? The complication. So what are the complications of diabetes? We have what? High blood sugar. High blood sugar, which is when the high blood sugar damages the organs and the tissue throughout the body. I come again. It is what? The blood sugar which damages the organs throughout what? The bodies, which means the higher the blood sugar, the longer you live with it, the greater what your risk becomes. The higher the blood sugar, the greater the longer you live with it, the greater your risk what becomes complicated. So we have some complications which I'm going to share with you right now. We have some complications of this diabetes. We have the heart attack, we have the stroke, we have the heart disease, we have what? Foot damages. When we say foot damages, e.g., like I said before, the sore that does not heal is one of what? The foot damages. And we have depression, we have dementia, we have what? Skin conditions, and such as what? Bacteria and what? Fungi infection. So we have genital diabetes. Genital diabetes complications is what? Premature birth, low blood sugar, stillbirth, and jaundice. Okay, we come again. Gestational diabetes complication is what? Low blood sugar, stillbirth, jaundice, and what? Premature birth. So we have some conclusions here, which is, in order to keep your body sugar steady, you must eat healthy. You must eat healthy. Does not mean you eat a much portion of food. No, you can eat as little as small of the portion of the food. Then it will enable you what? To keep your blood sugar what? Normal. But eating being small portion of food must be food that contains what? Vegetables, food that contain fruits, food that contain whole grains, food that contain fish, that contain fruits, food that contain whole grains, food that contain fish and poultry. And we have nuts, we have vegetable what? We have the vegetable, the olive oil. So eating a balanced diet food helps out what to prevent and to what to prevent diabetes. I come again, eating a well diet food helps out to what prevents diabetes. So thank you so much, everyone. With the little of this, I hope we're able to understand how we need to take care of ourselves to prevent ourselves from diabetes, to prevent ourselves not to get to diabetes type 1, not to get to diabetes type 2. It is good when you find you have to take sugar, but you have to take it at little, so you don't get things complicated what for yourself. So diabetes has its own way of damaging our body. So let's try as much as we can to take food that is well balanced diet that has to do with much fruits and vegetables. With this, we can be able to keep ourselves to be prevented of from diabetes. So thank you, everyone. Thank you for coming across Gift Test, my YouTube channel. Thank you for liking. Thank you for watching my YouTube. Thank you for watching. And I tell you, stay tuned for more videos on our channel. God bless you. Thank you, everyone. Bye.